Today, we're going to talk about generalized anxiety disorder, or GAD for short. We'll look at what GAD is, some of the symptoms, and 4 important signs to look out for. So what is generalized anxiety disorder? According to the Anxiety and Depression Association, generalized anxiety disorder is persistent and excessive worry about a number of different things. People who experience GAD may find it really difficult to control or stop the worrying. And this is different from regular stress because it's not a specific situation that's causing their anxiety. It's a multitude of things: money, health, family, work, but there's no real indication that's telling you, yes, you should definitely be worried about this. So for instance, someone may be overly concerned with the health of their family, despite getting a clean bill of health from the physician's office. You would think, oh, you don't need to worry, you've got a clean bill of health. The key words are persistent and excessive. Additionally to this, even if there's not a specific stressor to point to, there may still be a fear of something catastrophic happening. Again, despite there being no signs to indicate that something negative is going to happen. Now let's talk about some of the symptoms. Some of the physical symptoms include fatigue, irritability, trouble sleeping, muscle tension, trembling, nervousness, sweating, even nausea. It's also helpful to keep in mind that these things have to occur for a certain amount of time in order for a medical or mental health professional to diagnose with GAD. Here's a really big one: overthinking plans and solutions to all of the worst case scenarios. And these are just to name a few. I think it's important to remember that we don't know what people are struggling with. So even though you may hear somebody talk about their fears or their concerns or their worries, and you're like, that doesn't make any sense, I would never worry about that. Let's refrain from minimizing their experience, but also acknowledging that maybe what they're worried about doesn't add up to what's actually happening in the current moment. And if so, recommending that they seek professional help from a mental health professional. I always like to say we only see the outer layer of people. We don't always get to see the layers behind it that make up the person. And so refraining from judgment just on the first layer that you see is recommended, which is the same thing that we as humans would like from other people, for us as well. Let's move on to 4 things that you should look out for. Number 1, the worrying is uncontrollable and causes distress. Number 2, the worrying impacts your daily functioning. So the way you are at work, the way you are at school, the way you are with your family, your friends, it impacts all of it. Number 3, you feel as though you cannot let go of the worries, no matter how hard you try. And number 4, you worry about a multitude of different areas in your life on a persistent and excessive basis. These are the 4 important signs to keep in mind if you see that with somebody else, or if you yourself have experienced this for long periods of time. GAD can happen at any time within the life cycle, and there's not too much research on what causes it. However, there is help. Seeking medical professional advice from a licensed psychiatrist or psychotherapy with a mental health professional. These 2 things combined have been proven to help effectively reduce the symptoms of generalized anxiety disorder and give people their life back. Thank you so much for watching this video. I hope that it was educational and insightful for you, and that you're able to move forward with your own individual research or seeking medical professional advice. Don't forget to subscribe, like, and comment below. It really helps my channel grow. And let me know what you want me to talk about next. Anything mental health related, I've got you. Take care and see you next time.